Do people realize that vitamin B12 is not absorbed after a certain age? It is water soluble. It is a vitamin that the body needs for important functions, such as making red blood cells and maintaining healthy nerve cells. B12 works together with folate in the synthesis of DNA and red blood cells. It's also involved in the production of the myelin sheath around the nerves and the conduction of nerve impulses. Myelin is the insulation that protects the wires that conduct messages, allowing them to communicate with one another. B12, also known by the scientific name cobalamin, is water soluble. Not like other water-soluble vitamins, B12 doesn't exit your body quickly in urine. It is stored in your liver, kidneys, and other body tissues. The liver stores approximately 3 to 5 years' worth to ensure no deficiencies occur. And a deficiency may not show itself for a number of years, depending on your diet and your body's ability to efficiently absorb it. The time lag is a serious concern. After about 7 years of B12 deficiency, brain damage can result, possibly irreversible. It is not known, people do not realize the extent of this deficiency of B12. It is fittingly known as the energy vitamin, a powerhouse micronutrient for a whole host of reasons. Your body needs B12 for proper digestion, food absorption, iron use, carbohydrate and fat metabolism, healthy nervous system functions, promotion of normal nerve growth and development, help with regulation of the formation of red blood cells, cell formation and longevity, proper circulation, adrenal hormone production, healthy immune system function, support of female reproductive health and pregnancy, feelings of well-being and mood regulation, mental clarity, concentration, memory function, physical, emotional, and mental energy. That's pretty well our whole life, just bundled up right there. It is. In the normal absorption of vitamin B12, the vitamin combines with the protein produced in the stomach called intrinsic factor. It allows the small intestine to absorb the vitamin just before moving stool into the large intestine. After absorption, the vitamin moves to the liver for storage until needed by the body. In extenuating circumstances, even babies, children, and young adults are B12 deficient. As the digestive system breaks down, especially if one has been following the standard American diet, the lining of the stomach can gradually lose its ability to produce hydrochloric acid. That in turn releases B12 from the food. So if you know or suspect you're vitamin B12 deficient, you're not alone. Recent studies from the U.S. Framingham trial show 1 in 4 adults in the United States are deficient in this vitally important nutrient, and nearly half the population has suboptimal blood levels. B12 deficiency is an invisible epidemic. It's written about in every medical textbook, with its causes and effects well established in scientific literature. However, B12 deficiency is far more common than most healthcare practitioners and the general public realize. Data from the Tufts University Framingham Offspring Study suggests that 40% of people between the ages of 26 and 83 have plasma B12 levels in the low normal range, a range where many experience neurological symptoms. Most surprising to the researchers was that the fact that low B12 were as common in younger people as they were in the elderly. Why is B12 deficiency so underdiagnosed? It is often missed for 2 reasons. First, most physicians do not routinely test it. Second, the low end of the laboratory reference range is too low. Many B12 deficient people have so-called normal levels of B12. Yet it is well established in the scientific literature that people with B12 levels between 200 pg/ml and 350 pg/ml levels, considered normal in the US, have clear B12 deficiency symptoms, and Japan's policy is to treat levels of B12 under 550 pg/ml. There's quite a difference there. Experts who specialize in the diagnosis and treatment of B12 deficiency suggest treating all patients that are symptomatic and have B12 levels less than 450 pg/ml. They also recommend treating patients with normal B12, but elevated urinary methylmalonic acid, MMA, and homocysteine and or holotranscobalamin, other markers of B12 deficiency. So there's a whole range of things that interplay there. So here's a list of diseases that can mimic the signs and symptoms of vitamin B12 deficiency. Alzheimer's, dementia, cognitive decline, and memory loss, collectively referred to as aging. Multiple sclerosis, MS, and other neurological disorders, mental illness, depression, anxiety, bipolar disorder, psychosis, cardiovascular disease, learning or developmental disorders in children, autism spectrum disorder, autoimmune disease, cancer, male and female infertility. Common symptoms of low vitamin B12 include fatigue, weight loss, constipation. Symptoms of low vitamin B also include weakness and decreased appetite. Without replacing B12, the symptoms may worsen and include confusion, depression, and difficulty with balance and walking, dementia, and memory loss. If you do not have adequate vitamin B12 levels in your bloodstream, you might notice some of the following warning signs: mental fogginess, problems with your memory, mood swings, lack of motivation, feelings of apathy, fatigue, lack of energy, muscles tingling in your extremities. With vitamin B deficiency, the myelin can be depleted. In that case, you can experience health problems as widespread as depression, dementia, and even symptoms that mimic multiple sclerosis, because there is myelin over all of the nerves. It is that sheath that covers throughout the body, so that's why it can kick up anywhere. Depression has been linked to a shortage of compounds called monoamines, manufactured by the central nervous system. The vitamin B12 helps your body make these compounds. There is also evidence high levels of homocysteine associated with B12 deficiency may promote depression. A lack of vitamin B12 can result in a condition called pernicious anemia. It is characterized by a lack of healthy red blood cells and a larger size of existing cells. Anemia is the final stage of B12 deficiency. Long before anemia sets in, B12 deficiency causes several other problems, including fatigue, lethargy, weakness, memory loss, neurological and psychiatric problems. If you have trouble sleeping, it could be a lack of melatonin in your system. It is known as the sleep hormone, and B12 plays a crucial role in melatonin production, making it another reason it is important to make sure you're receiving an adequate amount of this vitamin into your blood. Inadequate vitamin B12 levels have been linked to many neurological conditions in addition to dementia and Alzheimer's, including spinal cord disease and peripheral neuropathy. a disease or dysfunction of the peripheral nerves, and can include numbness and tremor, as well as opposite sensations like tingling pain, itching, and pins and needles. Your skin can become hypersensitive to the point where you can't stand to have anything touching certain areas of your body. Clothing and bedding actually cause pain. If your muscles are involved, they may feel weak, tired, or heavy. And you may experience muscle cramps, tremors, and soreness. A lack of B12 might also be implicated in migraine headaches and Parkinson's disease. Both are neurological conditions. Vitamin B12 deficiency has also been linked to psychiatric disorders grouped into the following methods of expression: mood disturbances, apathy, depression, eating abnormalities, behavior disturbances occurring specifically at night, hyperactivity, agitation, euphoria, irritability, lack of inhibition, and motor disturbances, psychosis, hallucinations, and delusions. Causes of B12 malabsorption include microbial imbalance on or inside the intestines, leaky gut or gut inflammation, atrophic gastritis, or low stomach acid, pernicious anemia or autoimmune conditions, medications, especially PPIs, proton pump inhibitors, and other acid-producing drugs, including Prilosec, Prevacid, Asofex, and a host of other PPIs. Long-term use of these has also been associated with low levels of magnesium. Analysis of patients taking PPIs for long periods of time showed an increased risk of heart attacks. Alcohol also causes malabsorption of B12. Exposure to nitrous oxide during surgery or recreational use. And this explains why B12 deficiency can occur even if people eating large amounts of B12 contained in animal products, even though they are eating meat 2 or 3 times a day. In general, the following groups are at greatest risk for B12 deficiency: vegetarians and vegans, people aged 60 or over, even 40 or less, people who regularly use PPIs or acid-suppressing drugs, people on diabetes drugs like metformin, people with Crohn's disease, ulcerative colitis, celiac, IBS, women with a history of infertility and miscarriage. Long-term chronic B12 deficiency is known to cause deterioration of the optic nerves, resulting in blindness that can be irreversible. Cardiovascular and cerebrovascular diseases have a common risk factor: increased homocysteine levels in the blood. Studies show insufficient amounts of folic acid and B12 can elevate your homocysteine levels, potentially increasing your risk for heart disease and stroke. Low levels of B12 are specifically linked to increased risk for breast and cervical cancer. Less known is the fact that high levels of homocysteine are also very dangerous during pregnancy and can lead to complication and birth defects. Pregnant women with B12 deficiency carry an increased risk of having a baby born with neural tube defects, a class of defects affecting the infant's brain and spinal cord. Examples of that are spina bifida and encephaly. If you're planning a pregnancy, it's absolutely crucial to attain a healthy level of B12 in your bloodstream before you conceive. If you've had trouble conceiving or lost pregnancies through miscarriage, you should have your vitamin B levels checked. A B12 deficiency has been linked to infertility and repeated miscarriages. The use of antacids or anti-ulcer drugs also lower the stomach acid secretion and decrease the ability to absorb vitamin B12. The hydrochloric acid is a crucial ingredient in your body's ability to absorb B12. If you're taking a medication specifically designed to reduce the amount of stomach acid you produce, your body's ability to use vitamin B12 from the food you eat or the supplements you take will be significantly compromised. And that includes Tums. And how many times do we just take a Tum or 2 Tums 3 or 4 times a day because of bad stomachs? Vitamin B12 deficiency is extremely common in strict vegetarians and vegans. B12 is found in animal tissues, including foods like beef and beef liver, lamb, snapper, venison, salmon, poultry, and eggs. The few plant foods that are sources of B12 are actually B12 analogs. An analog is a substance that blocks the uptake of true B12, so your body's need for the nutrient actually increases. B12 is found only in animal products. B12 is the only vitamin that contains a trace element, cobalt. That's why it's called cobalamin. Cobalamin is produced in the gut of animals. It's the only vitamin we cannot obtain from plants or sunlight. Plants don't need B12, so they don't store it. A common myth amongst vegetarians and vegans is that it's possible to get B12 from plant sources like seaweed, fermented soy, spirulina, and brewer's yeast. But plant foods said to contain B12 actually contain B12 analogs called cobamides that block intake of and increase the need for true B12. This explains why studies consistently demonstrate that up to 50% of long-term vegetarians and 80% of vegans are deficient in B12. It is present in natural form only in animal sources of food. There are many well-documented cases of blindness and brain abnormalities in strict vegetarians, resulting from B12 deficiency. The effects on B12 deficiency on children are especially alarming. Studies have shown that children are raised until age 6 on a vegan diet are still B12 deficient years after they start eating at least some animal products. In one study, the researchers found a significant association between cobalamin, which is B12, status and performance on tests measuring fluid intelligence, spatial ability, and short-term memory, with formerly vegan children scoring lower than omnivorous children in each case. The deficit in fluid intelligence is particularly troubling, the researchers said, because it involves reasoning, the capacity to solve complex problems, abstract thinking ability, and the ability to learn. Any defect in this area may have far-reaching consequences for individual functioning. And there are many reasons why people choose to eat the way they do, and we need to respect people's rights to make their own choices. However, like all parents, vegetarians and vegans want the best for their children. That's why it's absolutely crucial for those who abstain from animal products to understand that there are no plant sources of B12 and that all vegans and most vegetarians should supplement with B12. This is especially important for vegetarian or vegan children or pregnant women whose need for B12 is even greater than adults. One of the greatest tragedies of the B12 epidemic is that diagnosis and treatment is relatively easy and inexpensive, especially when compared to treatment of the disease B12 deficiency can cause. Any lab can perform a B12 test. Some recent studies have suggested that high-dose oral, sublingual, or nasal administration may be as effective as injections for those with B12 malabsorption problems. However, most B12 experts still recommend injections for people with pernicious anemia and advanced B12 deficiency involving neurological symptoms. If you suspect you have a B12 deficiency, the first step is to get tested. You need an accurate baseline to work from. The next step is to identify the mechanism causing the deficiency. This is something you'll probably need help with from a medical profession or practitioner. Once the issue is identified, the appropriate form of supplementation, injection, oral, sublingual, or nasal, the dose and the length of treatment can be selected. And naturopaths can be very helpful in the diagnosis and treatment of this condition as well. Check the ingredients. You require methylcobalamin and as little as possible any other ingredients. Many people choose the sublingual method, a tablet under the tongue that goes directly into the bloodstream. It is available as B12. A sublingual complex of vitamin B3, 6, and 12 that I am aware of is called Trivita. And to give a more personal view, I'm going to discuss the B12 issues in my maternal grandmother's biography. She was born in England, came to Canada just before the First World War with her husband. This was his second marriage. His first wife had passed away from a miscarriage along with the infant. The B12 deficiency showed up with the death of my grandmother's second child, a daughter. The little girl passed away at the age of 2 of brain encephalitis. Within a year, she birthed her third child, a son. Soon after, my grandmother was diagnosed with pernicious anemia, the last stage of B12 deficiency. The only treatment then, and it is still used, was the juice of raw beef liver. It was ground up in a grinder. Sounds terrible, but it works. Ground up in a grinder. And she drank this 2 to 3 times a day. It did work. Her husband passed away in his 60s with leukemia. Some years later, she was diagnosed with breast cancer. Both breasts were removed, one right down to the rib cage. Also, her stepdaughter had the same surgery, though not as drastic. My grandmother lived to be 89. Her eyesight was gone by then. My aunt, her stepdaughter, was afflicted with Alzheimer's and passed away at about 90 some. My grandmother's third son, her son, and his wife had 10 children. His wife passed away at 42. 3 of their children have heart issues. The 2 girls both have macular degeneration. 3 sons have been attacked with cancer. 1 passed away with leukemia. And 1 is a vegan. In my immediate family, my dad passed away 10 years ago. He had been attacked with dementia. My mother, now 91, has macular degeneration in both eyes. This is the trail that B12 deficiency leaves through the generations. It's not generational. No one picks up on it. It hides in the background until a slight issue becomes life-threatening. Lives are ravaged. Families incur tragic losses that have spiritual, physical, mental, emotional, and financial effects that destroy marriages, estrange fathers, mothers, siblings, aunts, uncles, cousins. More seriously than that, it destroys our relationship with our Father in heaven, Jesus and the Holy Spirit. Living in a fog, under the blankets of demise and sloth, can we hear the voice of our Father calling? Jesus is calling his chosen generation, kings and priests, you and I right now. He came to give us life, and life more abundantly. Take your life back and your families. So blessings to all.